Welcome to all of you who have joined us today. My name is Carlette Dennis. I'm the coordinator of the National Library of Medicine Associate Fellowship Program. I'm joined today by current associates Ellen Thiem and Carlette Dennis, and by alum associates Louise Toe and Amanda Sawyer. So let's get started. Today, we're going to talk to you. I'm going to provide an introduction to the fellowship and a program overview. And then each of the alum or current fellows will give you something about their experience, the projects that they undertook while at the fellowship, and their steps that they've taken after, or for the current associates, what their current experience is like. Again, my name is Carlette Dennis, and I'm the National Library of Medicine Associate Fellowship Program Coordinator. And so let's go move from the agenda to the fellowship program. The fellowship is a one-year fellowship for recent graduates who are interested in a career in health sciences librarianship. The fellowship will be remote during the 2023-2024 fellowship year. The National Library of Medicine is currently undertaking a substantial and substantive renovation that the planning for which was started well before COVID. And because we were all out, we've decided to keep on staying out to allow the renovation to come to completion. So while that's taking place, we will continue to be remote. We will select between 4 and 5 candidates that will form a cohort during the fellowship year. The year begins July 1st, and the first half of the year, from July through December, is focused on an established curriculum where you attend 1-day to 4-day sessions. So there depends, the days vary, where NLM staff tell you about their work, how they accomplish it, and the impact of their work. You learn about healthcare data and standards, diversity, equity, inclusion, and accessibility at NLM and NIH, engagement and outreach, reference and web services, collections, both print and digital, cataloging, indexing, and about our databases, from PubMed, the premier biomedical literature database, to MedLib Plus, an internationally renowned consumer health resource. The second half of the year is focused on working on projects proposed by staff and a week-long visit to, hopefully it's in person, sometimes they've been a hybrid, to another health sciences library in the United States, as well as attendance at the Medical Library Association annual meeting. This year will be in Detroit in May. We will also invest in your professional development through meetings with NLM leadership, your participation in behavioral assessment workshops, resume review, interview assistance, negotiation training, and networking. Each associate fellow is assigned a mentor based on their career needs and goals. We use an individual development plan to guide your specific training needs. So who are we interested in recruiting? Well, we're interested in recruiting early career and second career librarians who are interested in advancing innovation and equity in biomedical libraries. We are looking for librarians who will have graduated by June of 2023, or who have graduated no later than June 2018. If you had an earlier career in any field and are now moving into libraries, we would welcome your application. So it's early career, not early in life. So early career. The criteria we use, or not only early in life, the criteria we use to evaluate applications are your work experience. First, we look for library experience, then other relevant experience. Then we look at your academic preparation, both in undergraduate and graduate programs, your response to application questions, which are, how will you advance an equitable and innovative future for biomedical libraries? And what would make you a great candidate for the National Library of Medicine Associate Fellowship Program? Then your references. We do ask that one of the references be from a library school professor, and then we make an overall assessment of, we'll be asked for 3 references altogether, one of which should be from a library school professor. Then we make an overall assessment of your entire application based on what we see as your abilities and potential. Since this fellowship is for early career librarians, we're looking less for experience, though it does matter, but more for where you can show your potential. How will you make use of the fellowship when you're in it? And what will you do with it with what you've learned when you leave? And that can be hard. You don't know what you don't know, but we're asking you to kind of sit and think, what do I want to get? How will I participate in this program? And when I leave, what do I hope to be able to accomplish because I've been in the fellowship? So our alums, where are they? Most of our alumni go into health sciences libraries, academic libraries, or in some cases, a non-traditional but health-related setting. These are some titles of some of our recent alums. One is a clinical librarian at Walter Reed National Military Medical Center. If I were at National Library of Medicine today, instead of in my home, I would be right across the street from Walter Reed National Military Medical Center. Someone else, one of our alums, is the SNOMED International. For SNOMED International, she's the customer relations manager for the Americas and a collaboration specialist. SNOMED is an international clinical terminology, and it's used by a lot of hospitals in the US as well as used internationally. And then one of our alums is the associate director for the network of the National Library of Medicine National Training Office, based at the University of Utah Eccles Health Sciences Library. And she does training and assists other trainers who do training across the United States in health information. I've been coordinating the fellowship for 15 years, and I can say that nearly all of the fellows have left the program to take a job or a next step that they wanted to take, that was the thing that they wanted to do, and to a large degree in the location they wanted to be in. Sometimes not always quite the location they wanted to be in, but pretty much all doing the kind of work that they wanted to do. So if you're interested in applying for the cohort that will start July 1st, 2023, the application deadline is January 27th, this month, January 27th, 2023, at I believe 11:59 p.m. Eastern Time. We are looking for your resume, transcripts, and we do look at them, we really do, and transcripts for undergrad and graduate, and answers to essay questions, or they might be called narrative statements or application questions. Those are the ones I mentioned earlier, and your references. Once you submit your application with names and contact information for your references, the system then prompts the references. They'll send a link to the references to fill out the reference. You'll be directed from the Associate Fellowship Program web pages on the National Library of Medicine website to a system called Zintellect. That's where we'll be capturing your application. We recruit for this program every year. So if this isn't a year that would work for you, consider applying for next year. Ooh, sorry, Louise, I'm bumping right into her statements. So my email is listed here on the slide, and I'll put it in chat in a moment. I'm going to turn it over now to Louise Toe, who is a recent alum of the Associate Fellowship Program. She's going to tell you about her experience. But thank you all for joining us. I'm really so delighted. Questions in chat or come off mute. And Louise.
Thanks, Cathals. I believe I have control over the slides now. Yes, I do. Okay. Hey, everyone. Welcome to the webinar. My name is Louise Toe, and I was an associate fellow during the cohort year of 2019 to 2020. See if it'll move the slides ahead for me. Oh, okay, there we go. So I just wanted to briefly talk about where I'm from. I grew up and was born on the island of Oahu, specifically in the town of Makiki. And that's where I also went to undergrad as well as my graduate programs. Specifically, I completed a bachelor's degree in ethnic studies and also the dual program of library science and education. Let's see if the slides will move forward. There we go. Okay. And in the library program, I was very interested initially in doing archives or public librarianship because before I went into my graduate programs, I worked at an arts nonprofit and I did youth programming and I also managed a photo archive. So when I wrote my essay to enter the program, those were the areas of librarianship that I felt most interested in. But then during the program, I ended up taking an internship with the Hawaii Pacific Health hospital system, which consists of 4 hospitals across 2 islands. They are Kapiolani, Palimomi, Straub, and Wilcox. And the solo librarian that managed the library for these 4 hospitals, his name is Dave Coleman. He turned out to be a really great mentor for me. And he taught me a lot about what it takes to be a solo librarian for a hospital system. So while working in the library was called the Arnold Medical Library, but we also just call it the Hawaii Pacific Health Library. While working there, I fulfilled reference queries, and I also developed several instructional tutorials on accessing the library's electronic collections. And as part of the work, we relied really heavily on one of the products that is offered by the National Library of Medicine, and that is the DocLine product. And there we go. So DocLine is an interlibrary loan system that hospital libraries heavily rely on because due to the limited budgets, they use DocLine to give their patrons access to publications that they wouldn't otherwise be able to access. And so being able to utilize that product and then become familiar with the network of the National Library of Medicine, which is NLM's largest outreach program, that kind of gave me an introduction to what NLM does for all of the nation. And so because I liked the internship so much and I liked being in the hospital setting, that's where I became interested in health sciences librarianship. And then that eventually led to my learning about NLM's associate fellowship program. So projects. Cathal mentioned that in the fellowship, you're going to be working on several projects throughout the year. And I think they're broken up between the fall projects, which are slightly smaller, and then there's also spring projects, which are bigger. For the fall, I picked a project that intimidated me. I think I saw the fall as an opportunity to learn something new and to also develop more technical knowledge in areas related to health sciences librarianship. This project was led by a staff scientist, and it investigated the viability of Wikidata, which is a structured, editable, computable database, as a means to make Wikipedia an info button resource in electronic personal health records. Now, if all of that sounds very confusing and you don't know what that means, that's okay. I didn't know what it meant either when I was reading the description for the project, but that's what sort of attracted me to pick up the project. I really was trying to focus on the fact that I wanted to learn about the mechanics behind consumer health. This research project produced a report that illustrated current ways patients access their health records and the technology of Wikidata, as well as info buttons, and also standard biomedical terminologies. After the project, I felt like my mind was more primed to understand how health information technology works. And also the project really helped me gain an appreciation for standards and their role in enabling interoperability. All right. So for the spring, I chose a project that largely utilized projects or skills that I had already felt that I already had in my wheelhouse. And that was like project coordination and outreach, skills that I'd gained from previous work experiences at nonprofits, and also through the internship. It was really just the subject matter that really attracted me to these projects. One of the projects involved serving in an executive secretary capacity for a newly formed policy working group that was charged with drafting a privacy principles document that addresses privacy with respect to emerging technologies such as artificial intelligence and machine learning. This project really interested me because I felt like privacy is a topic that is only going to increase in scrutiny, and knowing a thing or two about privacy, I think, is beneficial in the long run. So the work involved organizing meetings, creating briefing docs, recording minutes, and synthesizing a lot of opinions into one report. And the next project, let's see. The other project that I chose was supporting the Environmental Health Information Partnership, which is an NLM training and outreach collaboration with HBCUs, tribal colleges and universities, as well as other minority serving institutions. I did my undergrad in ethnic studies, as I mentioned, so I wanted to learn about programs that promote health equity. And the project initially focused on strategic transformation of NHIP, but based on some comments that we received from the executive committee, the project then pivoted to an oral history, but then we were interrupted by the pandemic, so we weren't able to complete those activities. But all in all, I would say that the methodology that I went with picking projects, I aimed to initially challenge myself with something that I was really uncomfortable with. And then I spent the second half of the year on projects that aligned with my values. And I would say being flexible is also key, because with projects, the status and I guess goals can change. So I would say it's helpful to have your own definition of what success means for each of your projects. All right, moving forward. There we go. So as far as benefits, I felt that participating in the fellowship really helped me learn a lot about large federal libraries, such as like how decision-making plays out in a really tall hierarchical structure, and also about federal funding and congressional appropriations, as well as contracting. And so I felt like, the policy team helped with that, but as also being in the environment as in the role of a contractor kind of gives you a feel for the way dynamics work in the federal workforce. I was also fortunate to be at NLM really at the same time that they were looking to hire a large group of early career professionals through the Pathways program for recent graduates. Having a step in the door through the fellowship definitely helped me get hired, I would say. All right, so now in my current role with the Office of Engagement and Training, I started out by managing a variety of community partnerships, including leading a large virtual NIH event for high school students, and also working with the Children's Inn at NIH. And for those of you who may not be familiar, the Children's Inn is kind of like a residential place like home for families with children and teens and young adults who are participating in clinical trials at NIH. Since then, my role has changed. I'm now managing, my main role is now managing a digital communications tool, which is called the NLM Technical Bulletin. It provides updates about NLM's products and services. So in addition to the maintenance of operations, I also lead planning around modernization to improve the user interface and also back-end management. In addition to that, I also serve on the training team. Oops. Sorry about that. I also serve on the training team where I produce instructional webinars on NLM's products. Like, for example, a couple days ago, I presented on an annual for an annual webinar on the updates of medical subject headings, which are controlled vocabulary for indexing articles in PubMed. Oh, I guess this jumped forward a little bit. And then PubMed, I think Cathal briefly mentioned what PubMed is, but it's a free database for biomedical literature citations. Really, every physician and health researcher knows about PubMed. And so on this slide is my email address. I'd be happy to answer any questions that you might have for me about the Associate Fellowship. And I'm going to transition now to Amanda, who will definitely provide more information about PubMed.
All right, let me see if I have control of the slides here. There we go. Okay. Hello, everyone. My name is Amanda Sawyer, and I was a member of the 2020-2021 Associate Fellow cohort. We were the first year to be fully virtual. Obviously, things in 2020 looked very different than they had the years before that. So our year was, I think, a bit of a learning process as far as virtual years go, but it was a great experience for me. And then, like Louise said, I currently work at NCBI. I'm a contractor for NCBI is a part of NLM. And I'm a contractor on the team that manages PubMed, that database of biomedical literature. So a little bit about my background. I actually did not have a health sciences background prior to joining the fellowship, other than I did work a brief contract job at a pharmaceutical company. And I'm going to apologize in advance. I have a dog and she frequently makes appearances in webinars and I can see her getting worked up. Okay, so I worked briefly for a pharmaceutical company in records management, but my background before the fellowship was actually in museums. I have a BA and an MA from Baylor University. My research interests originally in my career were focused on collections management for digital collections, as well as accessibility of digital collections. And I had worked for a few years in both museums as well as academic libraries before I decided to go back to school. I'd been working in an academic library and I needed the MLIS degree in order to advance in my career. So I went to the University of Pittsburgh. That's where I lived at the time. University of Pittsburgh has kind of a unique program where full-time students finish in just 1 year or 3 semesters. So I started in August, I finished in August of the next year, and I started the fellowship almost immediately after I graduated. The University of Pittsburgh had redesigned their library science curriculum at the time that I started, and they were focusing more on data management and data science in addition to your more traditional archives and other library science curriculum. And so I got a lot of training in that, and those were things that I also was doing in my academic role. I worked in scholarly communications, and I was using Python to help them do some collections analysis and understand their collection a bit better. So when I saw the fellowship advertised, that was the part that really drew me in, is the data science. NLM has a pretty strong focus on data science for health sciences. 1 minute, I apologize.
Yay!
This is Zoe. Okay, so again, it was the focus on data science that really drew me into NLM at first, and then also the opportunity to do something in my career where I felt like I was really making a difference and having an impact on people's lives. My brief stint working for a pharmaceutical company convinced me I was not content to just work anywhere. I wanted to work somewhere with a mission and values that aligned with my own. And NLM kind of gave me that opportunity. And so when I was interviewing, because I didn't have that health sciences background that some people come into the program with, I was pretty nervous about that, but I decided to focus my application materials on my existing data science skills and then my desire to grow more in that area and why health sciences made sense, like why I wanted to continue my career in health sciences. And I think that ultimately that's what made me a good fit for the program. and also the program a good fit for me as well, ultimately. And this is just a screenshot of PubMed. This is the database that I work on now. So I'll talk a bit about my projects as well. I saw there was a question in the chat about the freedom to choose what you want to do. It's yes, you get to choose your projects. They are based off of what NLM staff put into, we call it the job jar. Staff members propose projects based off of needs that the library currently has, and then you as a fellow get to go through there and apply and talk with staff and choose what you want to do. So I did a total of 5 individual projects during my time in the fellowship. I think being virtual allowed me to take on a few more than maybe I would have done otherwise. But I'm a person who really needs to learn things in like a practical real life situation. I love reading, I love learning things in theory, but until I really get my hands into it, I don't feel like I understand it. So that was a huge draw for me for the fellowship as well. And so my first project that I did, I actually worked with another associate fellow on this. MESH is the medical subject headings controlled vocabulary, and it's used to index citations in PubMed. And so the process for proposing new MESH terms each year, you as a person who maybe uses MESH, you can write into our help desk and propose new terms that you think should be included. And once a year, staff have to go through and evaluate those and see if they meet certain criteria that we have. And in the past, that was always done manually. And when there's, maybe 100, 200 proposed new terms, that's a very time-consuming process. So a colleague and I wrote a script in Python to do some of that process automatically. Some of the PubMed searching, we used the eUtilities API and wrote a script for that to be done automatically. Not all of it can be done. You still need a human to review and look at things, but cutting out that first step of kind of like repeat searching things sped things up quite a bit. Another project I did, I wanted to get some more experience in qualitative analysis in addition to quantitative analysis. So I was a part of a team that evaluated responses that came in on a request for information. When the government sends out, is making changes or sends out wants more information on something, they'll put out a request for information. And this particular one was about common data elements. So the survey went out, there was a time period where the responses came in, and then we did a qualitative analysis and wrote a paper and a report on that to be given to NLM leadership and NIH leadership. And then the third project that I will highlight here for you was about real-world data or observational data. This turned into a year-long project, and for me, it was the most challenging project that I tackled while I was in the fellowship. I worked with a staff scientist at Lister Hill, that's another division of NLM, and our goal was to look at real-world data or observational data, which is these are ways that researchers can get information about health and get basically, there's clinical trial data where you get like that highest level of evidence, and then real world data is something that's secondary. So an example is like Medicare data. There's a lot of data that is collected about patients and about drugs and conditions that they have. And we can learn a lot about the impact of those medications by looking at that data, but it's not the same thing as a clinical trial. So there are these databases that exist that hold these types of data. And the staff scientist I worked with wanted to get a better picture of what does the literature landscape look like, and then where are there gaps in the literature. So we took the MESH vocabulary that I mentioned earlier and did an analysis of that and identified some of the gaps in the literature. And then it turned into a spring project where we looked at that same type of data and how it was being reported in PubMed and analyzing our publishers supplying the information that they're supposed to be supplying to PubMed, because the publisher is ultimately responsible for reporting that. So that was a really cool project. We we did a lot of work on that, and it actually turned into a conference paper for me, as well as MLA presentations. Several of my projects did. And then finally, I'll close out on my experience by talking about the group project that my cohort did. This was another really challenging project for me. In 2020, the NIH launched a preprint pilot where they made some preprints that were written by NIH researchers available in PubMed. So our group took a look at those preprints and looked at them on platforms where comments were left on them. And the goal was to see, does making scientific literature available earlier invite more or provide more opportunities for commentary, for more rigorous research, for kind of democratizing the peer review process and getting more voices involved. And then also, is it resulting in better research on the end once it's published in its final version in a journal? So we looked at, those are really big, high, lofty questions. We looked at kind of a small subset of that. This was, again, a project that really challenged me. My data science skills grew quite a bit. I was just like self-taught when I came into the program, and then I grew quite a bit through this project as well as the real world data one that I mentioned. And then I was able to take those skills and the things that I learned and take those into job interviews. And like Louise said, I definitely benefited from the connections that I made during the program. Like I said, I'm a hands-on learner. I really needed these projects in order to feel like I was gaining that experience, but it was also the connections and the networking that I was able to do throughout the program that I think were some of the biggest benefits for me coming out of it. So in the spring of my fellowship year, I learned about the position that I currently hold and applied for it. And I learned about it through the connections that I had made in the library. And ultimately, it definitely helped getting my foot in the door for that interview process. And I'm very happy to be working at PubMed and on the team that manages it. So I will wrap up my part of the presentation here. Again, I'm Amanda. You are welcome to contact me if you have questions about my experience, about the fellowship, about PubMed. You can write to me about PubMed, but I definitely recommend contacting our help desk first. They will help you more. But I would love to talk to you more about my experience. Please feel free to reach out. And now I'm going to turn the presentation over to Carlette.
Hi, everyone. My name is Carlette Dennis, and I'm a current NLM Associate Fellow for the 2022-2023 cohort. Can you go to the next slide, please? Thank you. So just a brief history about myself. I'm currently in New Orleans, Louisiana, since the fellowship is 100% remote. I graduated from Dillard University, which is an HBCU in this area, with my BA in accounting. And then somehow, some way, I ended up working in public libraries for about 10 years. During that time of being a page to an associate, I was heavily encouraged by those around me, my supervisors, to actually go to library school. So about year 5, I decided to apply to Louisiana State University, where I received my MLIS and also a certificate in records and information management. I continued working at the library during that time, so I was full-time in school and full-time at work. I also interned with the Louisiana Supreme Court in the law library, and I also worked with the Archdiocese of New Orleans in their records and archives department. It was during that time, after COVID happened, when it first originally happened, that I found myself answering a lot of questions about public health, people wanting to know more information. So I found myself on NIH's website a lot. And that was when I sort of kind of remembered that while I was in school, I had actually applied for this fellowship before. It was like at the beginning of my second year at LSU. I did not get it, which was fine. But when the thought came around again. I said, well, let me apply again. You never know what could happen. And magically, I'm now here at the fellowship. So that was an amazing opportunity. It just showed me that even when you don't get selected in the beginning, you can still try again, and you never know what could happen. Right now, the fellowship is really amazing. I really, really enjoy it. I enjoy being around my cohort. We talk to each other all the time. So even though it's remote, you still are going to interact with the people that are going through this process with you as well. We just finished up our fall projects. I'm going to talk a little bit about the two that I selected. One dealt with updating the DEIA collection, the print and digital collection for NIH. And the other was about outreach and engagement with the health services research community. I really enjoyed working with all four of my sponsors. They were really just helpful and really encouraging. When I had questions, when I was a little confused about certain things, we would have meetings and we would just talk everything out just to try to make sure we all were on the same page. And it was just very, very comforting. One of the reasons why I decided to go into the fellowship was because I really wanted more experience and to learn more about the health sciences. And so I kind of feel like the projects have really helped me to develop an understanding about all the things that are affecting everyone around us. I think that my time in public libraries really helped to push that narrative for me. And that's one of the things that I really appreciate about the fellowship. Some of the things that I'm actually looking forward to in the spring, in addition to right now, we are actually picking our spring projects. So we have a lot to choose from. And so it's been a little interesting about how that works and trying to make sure that I'm getting everything that I want to get from this fellowship. Another thing is the spring practicum. Basically, how that works is that you're going to be looking at different health science libraries or different health science organizations, contacting them to see if you can shadow them for up to 7 days in any state. And so right now we're working on that as well. So I'm really excited about that. And also just interacting more with different individuals who currently work in health sciences. We have had a lot of opportunity to speak to a lot of different people, from the president of MLA, all the way up to the director of the NIH, NLM. So it has been really, really amazing. Next slide. If y'all have any questions for me, you can always contact me. My email is right here, and I will be more than happy to answer any questions that you have. Thank you.
Hello, hi, my name is Ellen Thiem. I am also a current associate fellow, and you can go ahead to the next one. I am so excited to be speaking with you today. Sorry, my dog just decided that he also needs attention, and he's very large, so his face might show up. Next slide, please. As I said, my name is Ellen. I graduated from the University of Missouri I School in May of 2022 with my MLIS. I didn't really expect to go to school, and so to undergrad, getting through that program and making my way here has been just really phenomenal experience. As I mentioned, I'm from Missouri. I now live in Arkansas, which is great, being able to do the fellowship remotely. And so the way that I learned about the fellowship was that I had current associate fellows speak to me in one of my library school classes. And then since I didn't really have an academic background, I was really interested, and I sort of shaped my library school experience around coming to the fellowship. And so I took classes, I participated and got my CHIS certification with MLA, and I tried to make my way here. So I also during that time pursued a fellowship through the Institute of Museum and Library Services, IMLS, and received that so that I could pursue medical health sciences education outside of the library school as a special grant. And so that I think was really instrumental in helping me understand sort of the landscape that I was going to be going into if I pursued medical librarianship. So mostly for my portion, I just wanted to say that I'm really excited for everybody to be applying, and I'd love for you to talk to me if you have any questions about joining the program. I think it's really important to me that everybody that wants to try to be a part of the fellowship does. And so please let me know if I can help with anything. And I'm just so excited to be here and to see you all here. So I want to make sure we have time for the interview tips portion. So if we can skip to the next slide, please. We just have some application tips here. The one that's bolded was mentioned by a couple of folks. And so I will open it up now for other presenters or folks to provide their own tips, or if anybody wants to ask questions. I think I just really want to make sure that everybody gets to ask all the things that you may not know, because I certainly didn't going in. So Amanda, Carlette, Louise, Catherine.
Ellen, thanks so much. I see Carlette has her hand up.
So I just wanted to say, as it relates to the bolded one, me and Ellen had a conversation about this when we were getting ready for this presentation. So when I applied for the fellowship and I had my first interview, I was really nervous. And so I had a feeling that I didn't answer like a particular question correct. And so one of the things that I do, like people tend to do, is to send thank you emails. And I went and applied the fact that I knew I answered this question not to the best of my ability, and I answered it within the email. After getting the fellowship, Cathal told me that that was one of the reasons that led to me getting to the next step, was the fact that in my thank you email for the first interview, I actually addressed that question. So you never know what a thank you email can actually lead to. So I would say make sure that you always try to, even when you think for a second that maybe this was wrong, maybe this was right, to just try to be open to putting yourself out there.
Thanks, Carlette. A good comment, and it was exactly right. I think the committee didn't think that part of your interview was strong, but everyone, when we met to discuss who we wanted to invite to join the cohort, said, well, she turned it around and she made it work. And it wasn't just that it was a thank you, it was a follow-up, and it was like a turnaround thing. And it's kind of our director will tell you, it's the director of National Library of Medicine will say, it's not the mistake you make, it's what you do next. So you really showed us sort of what you did next. And it was quite true. I mean, you had to do a good enough interview, and it wasn't the only thing, but it is possible for you all to influence your future and to mitigate something that you might think was a mistake. I saw, Louise, you had your hand up momentarily. I don't know if you've rethought it or.
I did. I mean, it's sort of related, but I was thinking maybe we should open it up for any questions that folks might have before we go on. And if no one has questions, then I will go.
Okay. But yeah, does anyone want to come off mute if you have any questions? I see some people are putting them into chat. Earlier, Julie, I think, had asked about interviews, and both Carlette and I think Ellen mentioned, answered the question, but I didn't want you to think I didn't see it. So I didn't see it. So I would like to answer it now, which is once we get the applications, there's a screening committee that will evaluate your entire application package and then make a decision about inviting about 20 people for a screening interview. And it'll be about half an hour. We will send you the questions in advance, nothing trick about any of it. We usually ask the current associates if they'll be buddy up. So you would get a buddy. So very open, very transparent. And then the screening committee meets and discusses the 20 people that we screen interviewed. And from there, we invite 10, usually people, to do a second round of interviews with a different group of people. And at that point, and I do very much mean this, I would take any of the 10 that we make those offers to, but we will make an offer to about 4 to 5. I don't know how many for next year. So that is our process. The second round of interviews, we have to find out if you can tell us in the chat. You think we should get you the questions in advance? We didn't last time, but we did for the first round. Yes, I sent you the names of the interviewers in advance. The first round is very, very open and clear. The second round, we still sent you the names of the people. I don't think we sent the interview questions. Different people answered differently. References, yeah, they're going to get, so when you enter everything into the system, into Zintellect, I haven't done it, so I'm theorizing this is what happens. Then, and I have had it confirmed for me, when you submit the application, the system then sends a link up to a form for your references to fill in. So, Julie.
Yes, I was wondering, would this program be a good fit for somebody very interested working like in a biomedical library, specifically with health and biology, biomedical professionals, basically, more like one-on-one? Or would you say that this is a program better suited towards people wanting to work for like medical librarian organizations?
I think it is a good program if you want to go on and work with researchers. I will say that's not the immediate experience that you would get at NLM, but you're going to get the experience of working and learning from people who make products like PubMed, PubMed Central, the preprint archive, gene databases, Medline Plus consumer database. You'll get to know a lot about our products, which people use, and then it lets you work with researchers better. There is another library on campus, they're also somewhat remote, called the NIH library that actually does work with the NIH researchers. So I always tell that people they're kind of like the real library on campus because they look and act a lot more like a library than National Library of Medicine does. We have a much, I would say, broader scope in what we do. So anyway, I think it is valuable, and we have had people who have done that. But if you come thinking, I'm going to get to work with researchers right away, that's not the case. We could probably make connections, maybe, but the focus is on the National Library of Medicine. So Amanda and Louise will probably do a better answer than me. Amanda.
Oh, I just wanted to follow up on that you have a reasonable amount of unstructured time in the fellowship to pursue professional development opportunities and to get trainings. And one way that I used that time is that I reached out to librarians that I saw doing work that I was curious about and said, will you meet with me? I want to learn more about your job and how you got here. So I got a lot of that experience that doesn't necessarily come directly through the fellowship curriculum by seeking people out on my own, introducing myself. And I think you'll find that most people are pretty willing to have those conversations. And I identified people by going to webinars and trainings and saying like, oh, that looks really interesting. And then I just follow up after that. As well as, like Cathal said, the NIH library, I met with people from there quite a bit and took some like one-on-one lessons from people there. So there's a certain amount of the fellowship, at least in my experience, that can be customized to fit what you want to do within health science librarianship.
Thank you.
Perfectly said, Amanda. Thank you. And thank you for referring to it as unstructured time and not free time. That is good language use. So Louise.
Yeah, it's related to this. Based on whatever projects are proposed, you do have the opportunity, if it does come up in the projects, to work one-on-one with certain researchers and staff scientists. Like Amanda and I know we got to have one-on-one projects with people from Lister Hill, and so they do a lot of like biomedical communications research. So I'm not sure if that's the area that you're particularly interested in, or if you were like specifically librarianship topics. That I think are broader, and it speaks more to what Cathal was saying about products for libraries. That may be more the area that the fellowship would be involved in, as opposed to specific research.
Yes, thanks, Louise, for that clarification. So NLM does have researchers. There's an intramural research program, but primarily their research is computer-based, computational biology, or semantic they've done stuff with semantic medline, natural language processing. I used to be able to say NLM does not have any wet labs, but that's not completely true. Now we have a researcher who was recruited to NLM in the last couple of years who has a lab at the National Heart, Lung, Blood Institute and at NLM. So she's in both institutes, and she does have a wet lab, which is not computer based. So so our research is basically the computers, with computers. Yes.
Thank you.
You're welcome. Any other questions? I'm trying to think. I did answer the one about applications. I will say sometimes I follow up and ask people who started the application but didn't finish it. If I get an opportunity, I do email them. More often than I would like to, I hear people say, oh, I didn't think I was qualified, so I didn't continue the application. And I look at what their qualifications are, and I don't tell them because nobody here needs to hear it after the fact. But a lot of times they would have been very qualified. So they were qualified to apply. And in some cases, I can tell just by looking that they would have made probably our first cut and been in the screening interview round. So it's a lot to gather. I do understand that. It's not just applying with a resume and a cover letter. It's a resume, answers to specific questions, transcripts, and naming references. So I do understand that it is quite a bit to put in. But I would just encourage you not to count yourself out. It may not be the right thing for you, but if that's the case, then don't apply. But if you think I really would like it, but I don't know, think about applying, because don't be the one who counts yourself out. Count yourself in, and then talk to us, and we can make it work. And the other part of that too is we do ask for official transcripts, but I know sometimes universities it can be hard. If we get your unofficial transcript, that's fine. Then we can follow up and get the official one. I know if people have applied for federal jobs with USA Jobs, it's a little bit unforgiving. We're not quite as unforgiving. We're a different system. And so if you get in touch with me and say, I'm having trouble with this or that, we can usually help get you over the finish line. I'd rather be able to talk to you than not. So Maria Elena.
Hi, can you hear me?
Yes.
Okay. I know that the time period for graduation from a program goes back to 2018.
Yes.
And I'm just wondering, I'm not really thinking about this year's round of applications, but perhaps in the future. Does the degree have to be in library science, or could it be a related field? Because I have a more recent graduation date, but it's a different program, not library science per se.
We are looking for recent graduates in library or information science to be within that 5-year time period. So that is our sort of zone. And I am seeing Paige, you had asked if you don't graduate until fall of 2023. Yeah, we're looking for graduates to have graduated by June. And I don't have to make the painful decisions to say, make exceptions or not, which I would not want to have to do. I'm bound by our system, and the system will not let you apply. So just so you know that it's restricted.
Okay, because there is a program that most of the courses are LIS courses. But again, the degree, I already have the MLIS degree, but this was an extension and it was primary library LIS courses. So that's why I'm wondering if it's close enough to be able to.
So I'm sorry, could I ask, when was the MLIS degree?
That I graduated in December 2018. But the other degree is Strategic Intelligence USF 2021.
Yeah, and we're looking for the one that you got 2018, and it would need to be by June.
Okay. Thank you.
Mm-hmm. Are there other questions? We just have a few minutes and we did leave a decent, I think, amount of time for questions. And I appreciate the ones that have come in the chat. I think Carlette was asking references. Did people have, so Christy, was your question answered? About, yes, I hope I did. I said, our references don't need to write anything until they receive communication, not specifically from NLM, but from the Zintellect system. So that's the one that will send out the email. And we do have staff who will follow up. So between the 27th when it closes and that following week, staff are following up to see, can we get the reference in? They're contacting your references to make sure that they're coming in. And we will review an application with fewer than the 3 references. You're just scored down slightly because of that, because we don't have the full packet.
This is Wendy.
Yes.
Hi, if I may ask a question.
Yeah, absolutely.
I think Kathleen had asked if we're to include the bachelor and master's degrees transcripts. I'm not sure if that question was answered.
I'm sorry.
I apologize.
Yeah, we do ask for your undergraduate and graduate. You don't need to include the associate degree, just undergraduate and graduate.
Thank you. Yes.
And we do look at them. Thank you for that. I don't know if there are any final questions. This has just been very unexpectedly fun for me on a kind of gray day in the DC area. So thank you all for that. I'm happy to take questions afterwards. Email me. This is my job, and I love talking to people and love answering questions. And I know each of the associate fellows, both current and alum, are sincere in offering their email and willingness to answer questions. We're getting the round of thank yous, so I do know this is, it is a paid position. Oh, good. Yes, money's important. We offer a stipend at the level of a GS9 step 1 for DC pay locality. So we peg it to the federal stipend amount. It was $61,247. You guys could correct me but it'll go up because the federal employees got a raise. So we'll make it up to whatever the GS9 step 1 is. So it is that amount. And then we provide an additional amount towards your health insurance. So Wendy.
Thanks again. Does the undergraduate, does it have to be, can it be from any university anywhere in the world?
Yeah.
Okay. Thank you.
All right. So thank you so much. I'm going to stop sharing my screen, wave to you all in the boxes. Thank you for coming. And I'm going to end the session in a moment. Wendy, your hand's still up. Is there anything else? Or I know sometimes I leave my hand up too.
Oh, I'm sorry. I need
to. That's okay. All right. All right. Well, thank you all very much. It was really our great pleasure. And thank you, Michael and Lisa. Thank you for the support. Bye.